This is a lacrimal cannula. So there is also a plastic cannula. So the difference between a needle and this cannula is that, see, there is a blunt tip. This is, the tip is blunt, okay. So in that also, in that cannula also, plastic cannula also, this is, we can keep on we can sterilize and use it again. That is one, we have a disposable cannula, okay. So lacrimal cannula, we cannot put that syringe, that sharp end, because it will cause injury. So it should be blunt tip, okay. If it is too sharp, then you should avoid using. So this is the size of the cannula is small, okay. So even without dilating, I can do the syringing. But what happens if it is bigger? The punctum, you have to dilate, and for that instrument, what is needed? The full name is Nettleship punctum dilator. I cannot show you right now. In instrument class, we will show you. Right now, it is not available here. Okay. So two instruments we need. We need the lacrimal cannula and the Nettleship punctum dilator. Always the full name you have to say. Okay. That is a dilator. We used to dilate the lacrimal punctum. Okay. So we will try to do, if the punctum is normal, then we don't need to dilate it. So before how we proceed with the procedure, we have given the topical anesthetic drug. Now we will ask the patient to look at my forehead. So you need to explain to the patient that we will do like that, and we will do the procedure, and there will be fluid coming in your mouth. Why the fluid will come to the mouth? Because the nasolacrimal duct opening is there in the nose. In which meatus? Inferior or middle meatus?
Middle meatus.
Which meatus? Why you are confused now?
Inferior meatus.
চকুটো খুলিবচোন, মোৰ কপালত চাব হা, ইয়াতে চাই থাকিব হা, আৰু মুখত যদি পানী যায় ক'ব হা, চকুটো মেলি দিয়ক, আৰামছে থাকক, একো দুখ নাপায়, মই দৰৱ দিছোঁ. So I have explained you all the lacrimal drainage system. That is the external one apparatus, lacrimal apparatus. Lacrimal apparatus is constituted by the lacrimal gland. Lacrimal gland and the lacrimal drainage system. Two punctums. Then this is the inferior punctum. Then in your eyes also you all can see there are two punctums, okay, and superior punctum is there. You can see then one popped up portion. In that popped up portion only you will get the punctum. So superior punctum and inferior punctum. Sometimes the punctums become blocked also, okay. So punctums are, there are two punctums. After the punctums you have the lacrimal canaliculi. So two canaliculi will there, and then the common canaliculi. So anatomy is always important. Common canaliculi, then you get the sac here, okay, the fundus, the neck, and then the nasolacrimal duct that opens into the which meatus? You all will confirm and say me. Okay. So now before doing the procedure, we have given the topical anesthesia. Now we will dilate. This is too small, and we can, I think we can do it like that only. So I am doing to the inferior punctum, but actually the main we should do from the superior punctum. Now we will see how the fluid comes out. Dingit pani goise? Khai diok pani to. So she says that it is going in her mouth. So that gives us the result that nothing has come out. It has gone to her neck, to her mouth. She said, yes, I got. So it is patent. There is no blockage, nothing is there, it is patent. But if there would have been some blockage, then what would have happened? There might have been regurgitation. Now you have to check from which regurgitation, from the upper punctum, sometimes from the same punctum. So that gives, when it will come out from the superior punctum, that will give a different diagnosis. When it will come from the same punctum, that will give a different diagnosis. Okay.